I just want to tell you, if you're not familiar with this concept, that doing something sustainable means that it has to be, in the same time, good on environmental aspect, on a social aspect, but also on an economic aspect. It has to have all the three pillars, right? We don't do anything which is very good for the environment, fantastic for people, but is not sustainable on the economic pillar, all right? Because it won't last. So it's not a good thing to do. Do something less fantastic, but that we can do for a long time, and we have the resources to do. Okay? So I'll start asking you a question about healthcare system, all right? The question is this smart? And graphically, I show you this. On the left, you have the cost per person of the healthcare system, and on the right, you have the life expectancy. And you might see the fantastic performance of your system graphically. By the way, I'm pretty proud of a country which, you know, sometimes we are doing things good. I think you can figure out which is right. Yeah, I'm really sorry. They are the smart guys, all right? The smaller cost, the higher life expectancy. Now, they talk a lot of performance and solid management reasons, all right? Well, this is an extract from what is called an excellent framework, all right? This is the FQM, very popular in Europe. You have the Baldrige here in the United States, which is a very nice, excellent framework. But this is also pretty good. Basically, an excellence framework is a set of best practices and, you know, management rules that make your organization excellent in its performance, all right? And I'm not going into frameworks, excellent frameworks, but I want you to remember this for the whole presentation, so please pay a lot of attention. Excellent organizations achieve and sustain outstanding levels of performance that meet or exceed the expectation of all of their stakeholders. Are you familiar with the word stakeholder? Mm-hmm. Everybody?
Yes.
It's fantastic. Fantastic country. If I talk to stakeholders in Italy, everything, you know. Right.
Like a waiter or something?
This is the satisfaction level of the performance of the system by a few countries around the world. And I think that to have an average of 25.33 of people who say they are satisfied with the performance of that healthcare system is very bad. So if someone wants to convince us that they are doing an excellent job today with the healthcare system by the standard of a performance framework, this is pretty bad.
So only 16% of U.S. citizens
Yes.
say they're satisfied with the performance of the healthcare system?
Yes.
Oh my gosh. Whoa.
It's nice to know
Yeah.
that
Yeah.
there is a lot to do to improve the performance of the system. There's another important stakeholder, the taxpayer. And I found this really astonishing. You can read by yourself how many people think that 50% or more of the money spent in the system is just wasted. Can you see what you think of your country's healthcare system as citizens? More than 51%, I think. But look at Germany, for instance. To me, to think that one German citizen on 4 thinks something like this is really, fortunately there is no data for Italy. I'm really curious. So, we have seen about the expectations of citizens, users, all right? They don't seem to be very satisfied with the performance of the system. Now, another stakeholder, we just look at the column in yellow. which is nurses who regard themselves to be burnt out. Look at the numbers. These are competent people, professionals who know the meaning of burnout, and in these numbers, they report themselves or regard themselves as being burnt out. We call this an internal stakeholder, right? A stakeholder which is within the system. I've been an entrepreneur for a long time, and I would be very concerned if my people would feel like this. Very much concerned. Okay? Consequences should be of some concern, because excessive staff turnover is a concern. Staff has to be trained, has to be competent, you need that. There is a huge cost of staff replacement. In the private industry, it is considered that a medium-level employee costs 2.5 times the yearly cost to be replaced. It's a lot of money. We shouldn't be so easy at letting go employees, all right? 2.5 times the yearly cost. Of course, diminished quality of care, because burnt out people, they don't perform an excellent quality of care. Increased conflict in care relationship. We will find something else on this issue, all right? Oh, just by the way, there's the burnt out people who are suffering, and they're human beings we should somehow care about. And now, a very popular issue, which is defensive medicine. The first reflection comes from a study from Massachusetts Medical Society. They made a pretty wide survey, and they discovered these numbers. Pretty big numbers. 83% of physicians do use these tactics in defensive medicine. And these huge amounts of procedures are motivated by defensive medicine. I think the estimates of the cost are pretty scary, and they amount, just to transform it for the population of the state, because they didn't survey all of the physicians, so this is an inference, but it's about $450 per citizen per year. So for a family of 4, that's just short less of $2,000 per year, just thrown away because of defensive medicine tactics. All right. By the way, you can interrupt me anywhere. So just going ahead, but whenever you have a question, just tell me. Of course, we have not finished with this. There is even more, because a part of the cost is the quality of care that we expect from a system. And this is even more scary than the cost, because this means, these numbers mean that the quality of care is pretty much lower by this concern of defensive medicine. All right. Reducing the number of high-risk procedures means that there are some serious conditions which are not treated because of the fear. Just by the way, do we think, I know it's a bit rude, this picture is from Africa, they do circumcision with that kind of tool. It's not the case over here, but you say iatrogenic or iatrogenic? Iatrogenic? Iatrogenic. Yeah, I suspected that. No, there is Greek in that word, but that's scary because it's a huge cost to be subject to radiation or, you know, chemical therapies that you don't actually need. We have a great pharmacologist here. He could talk for hours about the side effects and adverse effects of chemicals. And if we take chemicals that we don't actually need, that causes probably an iatrogenic cost for the patient. All right? So we should think more about this, which is not so much considered in studies about defensive medicine. Well, and here I go into deep waters. There is this study which has been done in the United States, it's pretty recent, and they have discovered that the cost of defensive medicine, yes, it's high, but it's not so high. And also that the majority of the cost is the cost of defensive medicine and not of liability because of medical malpractice. Meaning that it is more the fear that we have about lawsuits than the actual cost of lawsuits.